FutureDDS family. Today we have a special episode for you all. Everybody who is considering oral surgery, you're definitely going to want to tune in to this episode. Today we have Dr. Emeka. Did I pronounce that right? Emeka, what's the best
Emeka, it doesn't matter.
Emeka, amazing. But anyway, Dr. Emeka here today with us. He has taken time out of his extremely busy schedule working at the hospital. So we want to introduce him and say, once again, thank you so much for helping us out today.
Well, I'm glad to be here. I appreciate you guys doing this. I think it's really helpful, and I wish I had something like this going on when I was applying.
No, definitely.
That's what we're
doing it for, honestly.
Literally, man. So if you could, just give everyone out there, all of our viewers, a brief reintroduction to yourself, a little bit about your journey, where you're from originally, and kind of, I guess, the course of getting to where you are right now.
Yeah. So I was born in Nigeria, in the southeast of Nigeria. And I left Nigeria when I was about 16, 17-ish. Then I moved to Northern Cyprus. Then from Northern Cyprus, it's a long journey, but I could try to cut it short. Because I moved to Northern Cyprus. From Northern Cyprus, I moved to Turkey. From Turkey to Latvia to Poland to the United States. So it's been weird, long journey. Trying to look for a better life and blah, blah, blah.
Mm-hmm.
Also, I did undergrad electrical engineering. I did undergrad in Europe, Latvia, and also in the United States at ASU, just to be able to apply to dental school. And your question is like, okay, why did you do electrical engineering and why dentistry? I just figured that what if dentistry didn't work? Like, what if I applied to dental school and I didn't get in? So what's the next plan? Do I have a job? Can I make money while I reapply? So I just thought that dentistry would be a good fallback degree to have, just in case things don't work out the way I want it to work out.
Amazing. And so you got into dental school, you went to dental school. What made you want to do oral surgery? I mean, like, was it something that you knew that you wanted to do ever since you started dental school, or did you kind of see it as, you started doing rotations and things, you kind of were exposed more to oral surgery, and that made you want to go into it?
So I knew I wanted to do oral surgery before applying dental school. I was thinking about either doing ENT or maxillofacial surgery and then specializing in the head and neck. Okay. So I kind of knew that was what I wanted. And the reason was because of my experiences as a child, having my tooth getting pulled without local anesthesia. As a kid, I mean, first molar getting pulled without local anesthesia was kind of an eye-opener. At that point, as a kid, I was thinking, what can I do to make sure that people in my community don't have to go through something like this again, right? But the issue was then I did not have opportunities back home in Nigeria to be able to effect the change that I would have wanted. So upon my arrival to the United States, I realized, man, I mean, I know things can be bad here, but it's just my experience has been that if you really, really want to get something done here in the United States, there are opportunities compared to every other place I've been in the world. It's just from my experience.
Right.
So that was why I pursued oral surgery.
Got you. Okay, so, I guess it's kind of unspoken, but everybody in dental school knows, like, you pretty much got to be the cream of the crop or just, like, really high to the top of the class to get oral surgery, traditionally.
Do you really?
Huh?
Do you really have to be?
I mean, hey, that's what we're trying to figure out. That's what we're trying to figure out right now. So that's the myth right now. But I guess if you could tell us any type of methods or tips or tools or, I don't know, any strategies you use to, of course, get really good grades, but also just to kind of, I guess, get your name known out there in the oral surgery world or things like that.
By the way, I forgot to introduce myself. So I'm, like I said, Dr. Emeka. And I'm PGY1 at Case Western, the only 5-year MD program in the country. But so getting back to what you were saying, yeah, to some extent, you need to be the cream of the crop, okay, to some extent. Right. But it's more than that, man. You can be the smartest man in the world, but if your personality is bad, who wants to be you? Who wants to work with you if you don't have a good personality? So. Yeah, that gets you to the door. But I've also seen people who are not top 10% of their class get into oral surgery, right? It's not about being top 10%. It's about giving it everything. And like you said, putting yourself out there. I did about 5 externships total of what I did. And at every externship, I'm asking myself, how can I present myself in a way that they know that this is it for me? This is all I want. There is no other option. This is all it is for me. So that's the biggest thing. People go in, they want to go home early. They don't realize that every move you make in an externship, man, they watch every move. Even the lady, the surgical tech is watching you. Everybody's watching you. So it's just, if to put it into perspective, number one, I mean, try to see if you can get all A's. If that doesn't work out, make sure you're not at the bottom of your class, or you're not in the middle of your class. At least first 20 to 30%, I think, can get you to the door, especially if you have a good CBSE. I don't know if you guys know what CBSE is, right?
So, yeah, we're familiar with I guess you could explain a little bit better, but it's an entrance exam for oral surgeon, or to get into.
Yeah, so it's basically the test that medical students have to take, but a shortened version of it for their medical license exam. So the med school students, like me, for example, now that I'm like in residency, would have to take a step 1, which is basically the CBSE, but a shortened version. CBSE is kind of a shortened version of it. So it's 200 questions. Now, you would hear people say, oh, you need to get a 70, you need to get an 80, you need to get a 60. Honestly, it just depends on the program. And also it depends on if it's a med school. Honestly, if you want to go to the med school portion, you need at least a 70. Like, for the most part, that's non-negotiable, man. Like, they want you to get a 70%, 70 plus in a CBSE, because they want to make sure you can pass step 1. Now, for a 4-year program, I know friends who had a 64. I had like 12 interviews. I had 14 interviews with a 66 for 4-year programs. So it just depends on what you're looking for. And there's no big difference between both, except that one person is getting an MD and the other person is not getting an MD. There's usually no huge difference.
Okay. And so what about preparing for that test? I mean, like, what tips do you have? Because, I mean, one of our friends was actually taking it, and we didn't see him for almost like 3 months. So, what are some study tips that you could give to any potential applicants?
Number 1 is dedication, man. You have to lose yourself. You really have to lose yourself. I took step 1 not too long ago, and man, I mean, it's more. I mean, okay, so let's put it this way. You have the tools, that you have to use to study for it. For example, the basics, first aid. What else? Anki flashcards are awesome, because that's why the scores has gone up compared to what it was like 4 or 5 years ago. But you got to be extremely dedicated. Oral surgery is not for it starts from the test. That's why they look at the test, so they emphasize a lot on the test as well, is because they know that if, for example, I don't know what dental school you guys in.
Oh, we go to Tufts.
Tufts University.
Is it what's it called? Is it medical? Are you guys with the med school?
We have similar curriculum like the first year. Our professors are pretty much the same, but pretty much halfway through first year, it kind of goes separate ways.
Okay, so in my school, for example, at ATSU, our classes were 1 week long. We never had classes with med school. So you see what the problem is? So if you're a dental student and you are in a program where you don't have classes with med school, you're actually going against everything. Like, you're going against everything to score 70, because most of the classes are 1 week long. So when you present to, let's say you apply and you get a 70 and you're from a school like mine, they're going to see that as a lot of hard work. I don't know if that makes sense.
Yeah.
You're going to see that as a lot of hard work. So at the end of the day, it just boils down to how bad do you want it. That's all it boils down to. The exam is not how smart you are. It's not about who is smart. Honestly, it's not about. I took CBSE again right before taking step 1, and I scored an 89. And that's not because I'm smart. It's because of how much work that I was willing to put in. So that's all it is. That's how I feel about the test.
It's hard out, man.
That's encouraging.
Yeah,
honestly.
No, I'm telling you, man. I'm telling you, it's really not. I don't know. People make it such a. I hang around people who have taken this test before, and some people make it such a big deal. They're like, "Oh yeah, it's such a hard test." It is a hard test, but if you study really hard for the test, if you study for a test that is hard, just like you think, "Oh, it's hard, so I'm going to give it everything." It's not impossible. It's just about how much you're willing to put into it. That's how much you're going to get back. And another big thing is trying to do as much word bank as you can. Try and finish first aid. Try and finish U-Word. So that's the word bank. You can finish that U-Word. You can finish, there's another one called Ambus. I swear, there is a lot of material out there now compared to 4 years. Imagine the guys who took it like 10 years ago.
Yeah.
They had no Google, bro. Or they didn't have 20 years ago. They had no Google, no any of what we're using today. There's Boards and Beyond. Like if you go to a school that you think your sciences are not so strong, go and get you Boards and Beyond. That guy is Dr. Ryan. I'm not trying to advertise for him. He doesn't pay me anything, but he is awesome, man. Like you go through his course, you should be good to write the test. I mean, if you're really, really dedicated, though. So that's the key thing. How much work. And that's what they see. Like when you go on externships, for example, and you see all those program directors, all they're looking for is, if I take this guy, for example, is this guy going to drop out 2 years from now? One. Number two, is this guy or girl going to become toxic? Let's say you get a 90 on the test, right? But you're a toxic human being. How can you work as a team?
Right.
So that's the big thing they're looking for, man. Once you score 70 and above, it becomes a thing of, can I work with this guy? And if they feel they can work with you, that's it. That's all it takes, man. That's really all it takes. I think it's just an opinion.
No, definitely. No, we appreciate that. That definitely shines a different scope into the whole world of oral surgery than we've been getting for the last couple of years. So definitely appreciate that. One thing I have to say is like, or I guess what's racking my mind is like, you know, you moved around a lot. What kind of factors went into you, I guess, deciding where you wanted to go to residency? Was it just kind of wherever someone would take you because, you know, you were comfortable with moving around? Did you fall in love with a few programs based off visits? Like, how did you kind of build your list of criteria on where you want to go?
There are some things I can't say here because I might get in trouble in the program. Because I can't say like where I actually really wanted to go.
Right.
But I'll tell you this. If you have a good score, okay, number one. If you have a good personality, number two, right? You start going to the interviews and you start talking with them, you kind of know where you stand. This is big. This is really big. Like when you do 1 to 5 interviews, you know where you really stand. And then it start coming down to where do I want to go? At least that's how I felt for it. I matched to my number one choice. It came down to where do I really want to go because I felt strongly about my application. And I felt strongly about my interviews and the people I talked to, the doctors I spoke to. I felt strongly that at this point I could go to my top 3 and any of the top 3 and be fine.
You were good.
But then there are actually other people, for example, who, because of one thing or the other, maybe condition, are not able to attain the same grades, and then they have to actually like say, okay, I don't care if I get in here, that's fine by me. But I was looking at, can I moonlight? That's huge for me. I wanted to make money while in residency. Mm-hmm. I mean, I know we get paid, right? But I wanted to be able to make money. I didn't want to go to, you know that if you go to a 6-year program, you guys probably know that you do 2 years of med school, right? Mm-hmm. So the issue with that is, if you go to a program where you cannot moonlight for 2 years, I feel like you're losing skills. All you're doing is studying medicine. Man, I'm good. I'd rather go to a 4-year before I do that. You see what I'm saying? So it's something you actually have to be really, really smart about. And it also depends on what you're looking for. Some people just want to do academia. They just want to teach. And that's okay. If you go to a 6-year program that is 2 years of med school and they don't moonlight, and that's what you want to do, that's cool too. But I had no problems with where I wanted to go. And when I came here, I interviewed here, bro. I knew it was it. I saw this guy, so I was like, I think I fit in here. You actually feel that. Like you go to a program, you're like, oh, I think I fit in here. Fine.
Gotcha.
You know what I mean? Like you talk to the residents, you hang out with the residents, you feel like, oh, you know what, this is it for me. So that's how I felt about this program that I'm in right now.
Amazing. Okay, that's kind of like the vibe of the place. Okay.
Yeah, honestly, when I don't know what you guys' what your plans are for, you plan on air residency?
Yeah, so
we're going through right now. We're going through like the application process right now.
For what? For what?
For AGD and GPR programs.
Yeah, just general practice residency and AGD. No specialization right now.
Okay, I mean, if you ever decide to go down that road, or even as you go through your GPR program, you kind of talk to the instructors, you talk to the program directors. You kind of know, like, do I really fit in with this guy? Can I work with this guy? Can I not work with this guy? You know what I mean? Like, you kind of know that. I went to some programs that I was like, yeah, I don't know if I can survive here for the next 1 year.
Right.
You know what I mean? So that's pretty much how you feel when you and turn your applications in early. I know the coronavirus thing is kind of messing a lot of things up, but like turn your applications really it helps a lot. I think so.
Okay, awesome. And so, can you kind of walk us through? Like you said that your program is the only 5-year program. So can you kind of like, I guess, walk us and the audience through like what your program actually entitles? Like, are you doing on call type of things? Like what's the structure of your program?
So for in the first year, you're basically doing OMFS stuff, like a lot of oral surgery stuff, extractions, wisdom teeth, trauma. What else? The biggest part is though, like you got to do a lot of internal work. You know what an internal work is? Like making sure everything is good for the big guys, like the guys above you.
Yeah.
Doing all the dirty work, man. That's one thing that they've gotten to explain to us very well, and that's fine because I mean that's how you learn. You do those small little stuff, you learn from that, and just don't complain and just keep going. So that's mostly what we're about in our first year. Now, in the second year, you go to med school. Third year, you're kind of doing your med school rotation. Then you come back to service too. Fourth year as well, you are on service, and then you go for general surgery, which is I think 6-7 months, and then fifth year you're the chief. I don't know how they succeeded in cutting it down to 5 years, but my program director, Dr. Qureshi, he's doing a great job. I mean, I don't know how he's able to do that, but he's the only. I know Nebraska used to do that before, 5-year program in the country. It was one of it, but for some reason, Case Western is the only program in the country that's still 5 years to today. I don't know if that answers your question.
It did. No, you did. Definitely.
Yeah.
But the hardest part, from my understanding, would be your first year. It should be your hardest part because you basically don't know anything. I mean, but you just got to show up and show out. Like you got to make sure that they know you're there to learn, you want to learn, and that's the biggest part of it.
Okay. And so, like, what's been like one of the? I mean, granted, I know you're in your first year still. What's been like a high of your program experience, and what's been a low? If you can say it, you might have it.
We don't do a lot of cancer at Case Western, but I think that's going to change. I'm not the biggest cancer fan in the world. I like craniofacial and orthodontic surgery. I know we do a ton of orthodontic surgery here, which is one of my goals, is to learn that as much as possible. So I don't know if we will consider that as a low, because one of the things about oral surgery programs is you choose your program too based on what you want to do. Mm-hmm. Like if you ever decided to go to Michigan, right? You're going to do a ton of cancer. They do a ton of cancer in Michigan. I'm talking Michigan as a whole. From my understanding, they do cancers in most of their programs. Mm-hmm. And I interviewed in some schools in Michigan, and it's a good program, but I just didn't see myself doing cancer long term. So that's why I ended up not, ranking those places really, really high. But I don't know if that would be a low. It would be like what I wouldn't consider it a low, in the sense I would think of it as just what the program is about.
Right.
You know?
Right.
Yeah. My thing was I was actually indecisive between a 4-year and a 6-year. I know I wanted the MD just because I want to be able to go back to Nigeria back and forth. Mm-hmm. And I actually had a friend who actually ended up in a 4-year. But the key thing is this. It all depends on what you want to do. Some people, if all you want to do is just straight up like oral surgery stuff, like teeth and titanium, then 4-year program is good for you. But if you want to do more like fellowship, from my understanding, I heard it's easier to get into a fellowship program if you have an MD. It's also easier to have hospital privileges. And being that I want to shuttle between here and Nigeria. If I don't have an MD in Nigeria, I think I would have a hard time doing anything in Nigeria. Mm-hmm. So I think I just thought the MD would be better. And I had options to go to the 6-year, but I thought like, well, 5 versus 6. I'll take a 5.
Yeah. Why not? For sure.
Yeah. So I couldn't tell you what would make you a huge, successful oral surgery resident. You probably ask me 5 years from now, and I'll tell you that. Mm. But at the end of the day, man, it all in everything I've done in my life, I've always seen life as what you put into it. It's all what you put into life that you get from life. Right. So if you want something really badly, if you really, really want it, but I used to farm. I used to farm in northern Cyprus, you know. But I knew I used to farm just like literally coal and cutlass to make $20 a day with friends. Okay, I used to sleep in my car. I used to sleep in the library. Okay, you know, so there's no excuse in life. If anything, if you really, really want something done, you just got to give. Even if everything is stacked against you, mm-hmm. you just got to give your 100%. Even if it doesn't work, then it doesn't work. But you know you give it all. You have the passion for it, and that's the biggest thing, man. It's just the passion. As long as that passion is alive and you give it everything, to me, that's all it takes. That at least that's been my experience. That's all it takes.
Awesome. Well, I guess just you know, and this is just kind of off the top of my head here. You know, I'm kind of interested in your eventual, I guess, what would you see as success at the end of this 5 years? Is it setting up a nonprofit program between here and Nigeria? You say you were trying to bounce back and forth a little bit. I guess, what's your overall, eventual goal with that?
So my goal would be, number one, I want to be able to practice here in the United States.
Okay.
So I'm still thinking about either doing private practice here or academia. I'm not 100% like for sure, but I'm open to teaching. I love teaching. I'm open to teaching. I know I know it's hard to get into that as well, but that's what I'm really open to. But I wouldn't also mind doing private practice. Then in Nigeria, I would like to go to Nigeria at least twice. It doesn't have to be Nigeria. It could be Ghana, somewhere in West Africa. I could go there twice a year and be able to do surgeries, jaw surgeries to correct people's malformation, especially kids. I just feel like, put it this way, I don't want people back home to go through what I went through. If I can treat one kid, that's one less kid that goes through what I went through as a kid. So that's just my perspective.
Okay. And so you seem to be a very, very motivated person. I mean, obviously, due to the position that you are. But I want to ask you, like, what do you use for motivation? You know, besides just the idea and the thirst to learn and do well. Like, do you listen to any podcasts? You know, do you do you meditate? Any books? Like, do you have anything that you kind of go to if you're looking to stay motivated?
I don't know, man. I think part of it is my journey in life. Mm-hmm. That, I mean, when you wake up in the morning, for example, and you walk down the streets and you have to walk over a dead body to get to school, it changes your perspective in life, you know. Mm-hmm. But most of my motivation, it just comes from God, man. I'm Catholic, and I believe strongly in Christ, in Jesus Christ. I don't know what you guys believe in, but it doesn't matter what you believe in. But I feel like my connection to God, it's it's the most important thing that has driven me as far as I am today. So that's it for my motivation. Apart from that, it's just also, I don't want to see people that went through what I went through, like everything I've been through. I just don't want to see people go through the same thing, you know? So I'm like, I wake up in the morning, I remember, and for example, let's say I'm facing an obstacle, but I have an end goal, right? Do I have to worry about that obstacle when the end goal is huge? You know what I mean? Like, why should I worry about what's right now when at the end of the day the price is bigger? You know, so that's the way I see life. There was one time I was in Arizona and I was trying to buy something at the store with my friends. Someone walks up to me, spits on me, and calls me the N-word. Now wait for this. Now the question becomes: do I risk everything I've worked for so far and start fighting this guy, or do anything that will bring me to court and I'll miss my classes and all that stuff? You put all that stuff into perspective, you're like, you know what, this can wait. Or I have a fight, for example, or I have a disagreement with one of my professors or one of my instructors because they've said something that is really bad, and I'm putting this into perspective. I'll give you another example. I had a patient once tell me, I told the patient, hey, we're going to be having, what's it called? What's that stuff they do every year, dentistry, they do every year.
The comment?
Every year. Oral cancer screening.
The screening. Okay, yeah.
So I woke up, I have a patient. I said, hey, man, we're going to be doing oral cancer screening at the zoo, right? So he asked me, what cage is he going to find me in?
What?
So the question becomes, do I get into it with this guy? No, I kid you not, man. No, I kid you not. This is real. The question is, do I get into it with this guy and cause but I have a whole goal ahead of me where if I get to where I want to be, I can effect a huge change in my community. So that's the huge thing for me. What motivates me are people like that too. Yeah. They motivate me. They make me want to be better. I'm like, you know what? I'm gonna be what you think I don't want to be. You don't want me to be. You know. So that's it for me.
Wow, man.
I can go on and on. I can really go on and on about the things that, as I don't know in your situation, but as Black men or Black women that you have to go through, and but you have to be really a strong-willed person and be able to brush things aside to be able to survive in a world that we live in today, in my opinion.
For sure, man. That couldn't be more important, especially with, I guess the culture and the climate and everything going on right now, man. And,
that's why I brought that up. That's why I brought that up.
The higher you climbing up that ladder too, getting into the world of oral surgery, you might be less likely to find some other people that, have similar experiences as you. So, it's definitely one thing to have, that keep that in mind, man. And that's a lesson that a lot of people should learn and take heed to. It's not that impulse and that emotion in the moment can be detrimental or extremely, positive 5 years down the road, and kind of harden your resolve. So
yeah, you really have to learn how to just, professionally just walk away, call it a day.
Man, appreciate that story, definitely, man. Thank you for.
Oh man, it's nothing, man. I'm trying to see if there's any more thing I have to add to it, but I interviewed I think I interviewed at 15 places total.
Okay.
I got bored interviewing, man. Like, you interview after 6, you're like, okay, it was just another day in the jungle. It was like, oh, not again. But I interviewed at least, I think I had like 18 or 20 interviews.
Oh, wow.
And I ended up, I can't remember how many, but I ended up just going to like 15 of them. But for interviews, it's like, man, you really have to know how to talk.
Mm-hmm.
And you really have to know how to talk, man. Because if you go in there and you're shy and you don't talk a lot, I mean, who wants to work with a shy guy or a shy girl? And one of the things they like in oral surgery, they like, this is crazy, but they really, really, in some programs, it's kind of weird. They will pick people based on I've seen that happen. Like, okay, the PQ based on if they think you want to do academia, for example. Does that make sense? Like most programs produce people. I don't know if your school, if you guys have an Oxford program.
Yeah.
I don't know if your school is like that, but most East programs can sometimes be like that. They think people want to do like academia. They think they're going to publish papers for them.
Okay.
I'm trying to figure out any other little things that I can think about.
There's
but
so
that's
many
pretty
different
much
levels
it.
to it. Like,
What you say?
Now I was saying there's so many different little levels and nuances to even just, applying or choosing a program, or even things to look out for. Like, if somebody asks a question we think might be a menial question, or they're just trying to learn more about us and they're trying to figure out if we like academia more, if we want to do, global healthcare awareness, or, local, underserved community work. So it's very interesting, and got to be very on our P's and Q's, heading into this next transition, a lot of interviews and stuff.
That's true. I actually went to an interview where they asked me if I was interested in going to mission trips. It was huge for them. They did a lot of mission trips. So they wanted to know if you wanted to do that. So that was big for them. So it's man, you just got to pick your poison. Like, where do you really want to go to? What are you looking for? This is the biggest thing. What are you looking for? If you want to do cancer, then go to a cancer program. If all you want to do is just take out teeth and place implants, then do a 4-year program. So if you want to do more than just cancer, if you want to do more than just a 4-year program, then you go to a 6-year, and that's pretty much it. There's nothing huge to think about when you're making the decision between 4-year and 6-year, except that in some 6 years you pay more. You pay 2 years of tuition, right? So that's like $100,000. So it just depends on what you want to do.
Very true. Very true. Well, I think all of my questions have been answered. That we can honestly sit here for hours and hours and hours, honestly, man. And I could pick your brain about everything. I'm sure Tyler could too. But I definitely want to see if you have any like last words of advice for anyone who may be interested in oral surgery, or just going through that process right now. Any things, reiterate something that you said already. Just before we close up here.
Number one is be true to yourself. Don't go to an interview and lie and say just be true to yourself. My dad has always told me that what's your own is your own. If it's for you, it's going to come for you, as long as you work hard for it. So be true to yourself. Show up to the externships and make sure you give it everything you got. If they say you should stand there for 15 hours, you best be standing for 16 hours. If they say we want you guys to be at 8, I show up at 7, and people are like, "Oh, you're gonna." I'll be that gunner. I need to get what I want, and if it means showing up an hour earlier, I'll show up an hour earlier. So it's just you just got to be dedicated. You got to be motivated, and you got to find that stuff that pushes you, that motivates you to be the best. And that's why we're here as healthcare providers. We want to be the best at what we do, and we want to be the best for our patients. So that would be my last keywords.
That's awesome. That's awesome. Doc, if anybody else has any other questions, what's the best way that they can get in contact with you?
I have an Instagram. I don't even know my Instagram account, but they can reach me at...
Use the text or something, and we can make sure we put it in the description for everyone.
Oh, okay. And you can also text me. They can also email me at cic16@case.edu. But I can send you my, what's it called? I can send you my Instagram account, and they can always, add me and we can talk. I've mentored quite a few people, even in my journey to this. So I'll be happy to tell people my experience. Everybody's experience is different. Actually, I know a girl that you probably want to interview. She just got into Baylor for oral surgery as well. So she's I think she's African American as well. And so it would be good if people can get it from different perspective, because this is my perspective. And so after I can shoot you a text and I'll talk to her and see if she's willing to do that.
Awesome, man. Well, again, on behalf of Tyler and myself, everyone viewing on our platform, FutureDDS, man, we want to say thank you again, Dr. Emeka, for giving us this this wisdom, this knowledge, taking us through your journey, man, and offering some great advice to everyone out there, especially anyone out there interested in oral surgery.
All right, boss. I'm glad you guys did this. I thought it was really important, and we maybe in 3 years, if you guys ever decide to go into oral surgery, you know, we'll probably come down to Case Western and do an externship or sometime. Just let me know.
Yeah,
we
man.
appreciate
Yo,
that.
definitely.
We appreciate that.
Yeah.
We'll have to do a part 2 to this or something, but yeah,
We
definitely.
have to, man.
Yeah,
I'm excited for you guys. Hey, man, I'm really excited for you guys. I'm excited for what you guys represent. I'm excited for your graduation next year, and keep fighting, keep moving. We got this.
Won't stop. Can't stop.
Can't stop. Won't stop.
Can't stop. No, there's no other choice. There's no other choice. This is it.
Yeah, definitely. But again, anybody out there, if you haven't already, man, make sure you hit that like button, the subscribe button, and the notification bell so you know whenever we post up new content. Make sure you hit up Dr. Emeka if you have any questions. And if you have any questions for Tyler or myself, add it down to the comments or head over to Instagram, follow us at _FutureDDS, and we'll get back to you as soon as we can. That's going to close it up for this episode. See you guys later. All right.